Hello, everybody. I'm Annie. I am one of the outreach coordinators at the Human Services Center Mon Valley. And I just wanted to thank everybody for attending our 2024 Mon Valley HIV AIDS Awareness webinar. I want to thank all of our sponsors, especially who are on the screen here, listed and with some logos. We really appreciate our sponsors making this event and these wonderful t-shirts possible. Um, so thank you all. We're so appreciative that you are making this event happen. And so with that, I'm going to introduce our speaker for today. Hazell Azzer is a Pittsburgh native, a graduate of Penn West Edinburgh, and a graduate of the foster care system. Through Hazell's volunteer work, Hazell has found a burning passion for community and advocacy. After finding community through community organizations like Project Silk and Allies for Health and Wellbeing, Hazell was able to understand the different community needs, the difference between, community needs and community wants. Today, you can find Hazell with AIDS Free Pittsburgh as the Community Outreach and Engagement Coordinator, where you can find Hazell developing opportunities for the community to be understood or visible. Hazell hopes to continue to inspire and encourage others to want to do better for their community. So with that, I will stop sharing and hand it over.
But good afternoon, everyone. I hope all of your days are coming along well. Make sure you're drinking water and make sure you're feeling healthy. I will begin by sharing my screen. Today is kind of exciting. We're going to be going over some of the stuff that we do here at AIDS Free Pittsburgh, and then we're also going to be going over just some tidbits on how you can be more successful in helping people feel understood, helping our community members know that we are aware of the changing language and stigma and situations that are here and social determinants that are here surrounding HIV. So as stated before, I'm the Community Outreach and Engagement Coordinator here at AIDS Free Pittsburgh. I've been here for about 2 years or probably exactly 2 years. Yes, exactly 2 years today. The phone number here is a phone number that you can catch most of the AIDS Free Pittsburgh staff. This is a 24-hour number, so almost any time that you reach out to it via text or phone call, someone will get back to you within 24 to 48 hours. So the fun meat, bread, and potatoes. What are we going to be learning about today? So as you see with this first slide, it says HIV starts with human. And that's because as we go through this slide, as we go through these slides, I want to continue to remind you all that these are people we are working with. They're not clients, they're not cases, they're not numbers. These are real life people. They have feelings just like you do. They get overwhelmed and they get uneasy, etc. So when you're working in the communities and you're working with them, we have to remember that they are human just like us. So today we're going to be able to go over some background and history for AIDS Free Pittsburgh. I'm going to highlight pieces of data that I find a little bit more important whenever it comes to outreach and just trying to figure out community programming and why those pieces of data are important to me as a Pittsburgh native. And then, yeah, as I was saying, we're going to find the importance of that data and some of the programming. And then at the end, I will allow time for you all to ask questions if there are any questions. So to begin, about us. Here, AIDS Free Pittsburgh in 2015, about 10 years ago, December 1st, World AIDS Day is when AIDS Free Pittsburgh began. AIDS Free Pittsburgh, our mission has stayed the same from the beginning. Our mission is to achieve an AIDS-free county and reduce the rate of new HIV infections by 75% 2030. We have expanded to the southwestern region of Pennsylvania. So now we house all 11 counties in the southwestern region. Services are available to them. As we know and understand, some counties have less resources than others. So some counties are a little bit more difficult to get resources to them, but it's happening. You'll see as we go later into the slide. Our vision. So We envision a community where new HIV infections are rare. People living with HIV receive the care that they need, and young people can grow up in a world without AIDS. AIDS is late stage HIV. There is a difference for individuals who may try to conjugate them together. They are not the same. AIDS Free Pittsburgh is a public health movement to end the HIV epidemic in the Allegheny County by 2030. AIDS Free Pittsburgh is a collaborative initiative comprised of government agencies, healthcare institutions, and community-based organizations that strive to support and improve the care of people living with HIV and AIDS, as well as communities most at risk for HIV. AIDS Free Pittsburgh does not, I repeat, does not provide direct services. Does not provide services directly, but rather works to raise awareness and build collaboration amongst community stakeholders. So I remember having a conversation with a colleague not too long ago, and they just kind of highlighted that to me that AIDS Free Pittsburgh is like extremely well known for what we do. And it's amazing because we don't have a pharmacy. We aren't like doing any direct like health lines or like any direct services to the client. So they find it really like respectable that we're able to do that and not have to incorporate medical case services. Like we're able to just continue to encourage our partners and encourage other AIDS service organizations to continue to do the work and like not, yeah, and just find different ways to break stigma. So moving forward so that we can continue to be on time. We are going to go over some overarching data with this slide. So since 2013, we were able to decrease the new HIV infections rate by 55%. So in 2023, we had 66 new HIV cases, and in 2015 when we started, and in 2013 when we started, we were well over the 50% margin, one being 139 and one being 118. So I just get really excited knowing that we're still on track to like getting it down to the 75% and just ensuring that like our communities are seeing what we're doing and they're like taking it into consideration. They're seeing the work, they're seeing the advertisements and the billboards, and they're getting the information. And the numbers show it. So another piece of really important data for me is new HIV cases by age group. With all of the different events and programming that we do and understanding the language of HIV, having a client who's 55 years old is going to be completely different than talking to a community member. I should not have said client, I should have said community member. So I will continue to correct myself. Language, huge. We'll cover that later. So yeah, talking to someone who is in the 55 plus age range is going to be completely different than talking to someone who is in the 25 to 35-year-old age range. So understanding those different disparities, understanding where their perspective is, will significantly help you with not only community engagement, but community understanding because the slang is different, the swag is different, the demeanor, like everything is just significantly different. So understanding how clients are from this age group or understanding how people are in this age range in comparison to today will be a significant help. And then it'll help you also understand where the language is going to be going, where stigma is going, and how people see it. And it also allows you to see the difference in education, especially generationally. Like we'll have some people call on the hotline who are 55 plus and they let you know from the gate, like, I'm not that educated, I'm not this, I'm not that, but this is what I want. And then you have people who are 25 to 34 years old and they get on the phone like, life is life and I don't know what I need. I don't know what I want. So then you have to somehow meet both of those clients or meet both of those individuals in the middle to find like the best place for them to go or find the best organization for reference. The next piece of data that I find extremely important is race and sex. So when the data was collected, I believe this was sex by birth. So we have 53%, I mean, not 53, 53 of 66 of the cases from 2023 who were male, MSM, and then you have 13 of those 66 cases who are female. Um, of those new 66 cases, you have just over 30 of them that were African American, just over 20 of them that identified as white, um, just a little over five of individuals who identify as Hispanic or Latino. And then I believe it was exactly three people who identified as multi-race. This is important because this shows you various pieces of culture in which our community is. So creating an event, you can create an event that encompasses all of these demographics. You can create an event that encompasses all of these pieces of community. However, will you really benefit all of those community members? Will you really benefit that demographic? I am not sure. Rule I could just kind of remind myself is that sometimes whenever your car needs an oil change, like, well, not sometimes, all times whenever your car needs an oil change, you're going to drain the oil from out the vehicle, put the cap back on, get your funnel. But for better events, you want to pour the oil directly into that funnel to go into the oil spool so that it's not like fouled all over the car. Whenever people create events that try to encompass or tries to become too inclusive, it's almost like they're just throwing the oil everywhere under the roof of the car and they're just hoping it gets to the right spot. Which, like, yeah, you'll have some oil in that oil spout and on that oil spill, or like where it needs to be, but it's going to be a bunch of other places it does not need to be. So you would have done a bunch of unnecessary work instead of trying to hone in and help that one space. Um, Examples of things that are beneficial for everyone, even though they were tailored for one specific demographic, are like the curved sidewalks that you see on the ends of the street. They were created for individuals who were disabled or who had some type of physical impairment, having trouble getting to and from the sidewalks. So when they were created, everyone now abuses and using them, even though they weren't created for that one demographic. So we will come back to this as well with language and all of that, because we're going to go into the programming, so you'll see why all of this is important. So, getting out there and programming in the community. Getting out there is meeting the community where they're at. So that can quite literally be geographically where they're at, like the neighborhood or the like grid location, but it's also like meeting them where they're at mentally and meeting them where they're at like socially. So some people like, sorry, my throat was getting dry. So for example, you'll have some community members who are in Wilkinsburg, and from the hotline, the calls that we get from Wilkinsburg, it's typically housing, transportation, then food. However, Homewood, same big three, but their calls usually come food, transportation, and then housing. Um, Same community needs, but just different priorities. So understanding that priority and why that priority is the way it is. Homewood doesn't have as many food options, so it would make sense why they are prioritizing food first. Wilkinsburg, they have like multiple modes of transportation. They have multiple, like I know that they have one food like grocery store that's right here, right off of the main drag, but some of their housing may be off. Like some of the, I see a lot of abandoned buildings in Wilkinsburg. So like understanding where that community is. Um, Understanding the needs and the wants of the community that you serve. Creating engagement that you would want to participate in. This is huge. Like a lot. of community members, they'll call or they'll inform us about events that they go to, and they were just outright boring. They told them, like, I only came because we got a gift card. I only came because of the incentive that was created for that event. Um, if you create an event that people are going to want to participate in and want to engage in, you may not need to create an incentive. You might not have to pay them to show up. They will just show up. Um, so yeah, that encompasses the last piece as well. And then developing a frame of how the community sees you um, is extremely important to me. Not knowing how the community sees you can cause you to lose support, and it will cause disarray amongst partnership and amongst like the relationships you have with community. Not understanding how the community sees you will have you continue to do the same programming with no result. And no one likes to do that. Um, like that's insanity. So building off of the programming and understanding the language, understanding that data. So Vogue workshops, like some of the programming we have here in AIDS Free Pittsburgh, just based off of the different like community needs and looking at the data, we develop Vogue workshops with True T. We have sex education social hour with some of our youth-driven organizations. So we've done it with the 412 Youth Zone, with the DHS in Auberly. We've done it with Cafe Momentum, which is also under the DHS umbrella. Um, and we partnered a little bit with Planned Parenthood for this. Um, but I know that they've taken over to a lot more since last year than we have. But the program is still available if any of your organizations want to participate in it or at least want to see what it is. We have mindfulness and fitness with Shepherd's Wellness Community. We began that program because a lot of their community members just wanted to do something a little bit more fit and they just wanted to feel um, like a little bit more healthy with their day-to-day actions. So that's what we do there. Like once a month, we'll meet up, we'll stretch, we'll get everyone good on like, what are you eating? What are you not eating? Why do you think you're feeling sluggish? Like, do you think it could be, as I said, some of the stuff you're eating, or do you think it could be like lack of exercise? Do you think it's lack of water, etc.? And then we have a community advisory board that also helps us like, or they don't, I'm in charge of it and they don't play with me. They tear a new hole in me every single time that we meet because they're passionate about what they're doing. Like we ask them to be the community advisory board. Let us know. What do you see as a community member? How are you feeling as a community member? Where do we need to be at? Most importantly, like where do we need to be at? Like some of our neighborhoods, we have really great programming there, and we will continue to have great programming there because we have those relationships with that neighborhood. But you want to expand, like you want to do good, you want to continue to have your word out there. Um, and then you want to consistently pop up in the community and engage into the community. So for some context, here at AIDS Free Pittsburgh in 2023, wrapping up the entire year, we participated in about 35 events and we sponsored 22 of those 35 events, contributing over $10,000 back into the community. Um, in 2024, so far, we have supported over 45 events and we were able to do just over $8,000 in sponsorships and donations. These numbers are important for me because I try to highlight to people that we understand finances are a huge restriction with all of our programming across the board, not just here in Pennsylvania, but just across the US. Um, and we recognize that it's not easy to do it on your own. So we try our hardest to do donations to almost every event that makes sense, and we try our hardest to participate in events that always make sense. So some events we might have just sponsored because we knew that they fiscally needed that help, but we didn't show up because we also knew that like how the community sees you is important. So sometimes like not showing up is more important than showing up. And I know that that sounds funny. I know that it sounds weird, and you can ask me questions on it later. I have multiple examples, but for the sake of time, I will just word it as such. Sometimes not showing up is just as important as showing up. Not showing up as a whole. Like you can show up as your own individual self entity. I'll start explaining it. I said I'll explain it later if any of you have questions. So, going back to community engagement, here are some examples of some of the events that we've participated in just this year. So, up here in the top right corner, you see that's myself. I had won the best Voguer, which was one of the newer categories here at the Best of Pittsburgh competition. We participated in the Pride Alcohol Free Gala. We participated in two of five of the Harambe festivals that happen here in Pittsburgh. Um, they're really fun and they're really, really like encouraging. Like, oh gosh, they brought like a large gospel artist out almost every Harambe Fest. It was really awesome. And if any of you want to participate in it, I really suggest that if you need help with getting contacts for the Harambe Festival, I can also put you in contact with them as well. Benefits of the Harambe, same with like some of the other events that are listed on here, like the Status Neutral and the Overdose Awareness Resource Fair, which was on August 30th. Events like this, they're most beneficial because you are real time getting community feedback, real time watching the community engage. You'll be able to see the stuff that the community likes. You'll see the items that they grab from tables. You'll see the tables that they walk up to because your presentation in the table is so huge. Like if your table looks boring, you're probably not going to get any traffic. If your table is intimidating with literature, you're probably not going to get any traffic. Um, Going back to some of the other events, we participated in the HIV conference that was facilitated by the Department of Health. We conducted a rep survey, which was basically testing, not basically, it was testing people's knowledge on PrEP here in Allegheny County and understanding what they know about PrEP, how they know about PrEP, etc. Um, and then some of the events that we put on here at AIDS Free Pittsburgh were like Too Hot for July, which I will get into. And we also did the Kink Doll Mini Ball, which was a collaboration between the Leather Pride community and the LGBT Pittsburgh's LGBTQ ballroom community. And it was really nice. Like it was nice. It was a lot of participation. It was kind of scary because it was like my first ball that I threw, and I just didn't expect that many people to come so quick, so hard. I was like, oh gosh. Um, Continuing in community engagement, we use different ways of media to continue to engage with the community members and to better the language of what we're saying to people. So sometimes we'll try something new out. We'll say, like some of the newer slogans that we've been practicing have been plays on the acronyms for HIV and AIDS. So one using HIV, we tell people that they're heroic, important, and valuable. HIV because realistically, you are heroic. You're telling your story, and it's important that you tell that story. It's important that you continue to try to live a long, healthy life. It's important that you care about yourself because living with HIV or not living with HIV, you only have yourself. Like we have friends, we have family, we have all of that. Yeah, all of that is nice to think about, but realistically, we only have us. So like it's important that you care about you. And then valuable. Everyone is valuable. We always care about all of our community members, all of our community leaders. Even if you're not in the community, I still care about you. Um, so we just do that with all of our different media, letting people know that they're appreciated, especially through social media, and some of our big name media like the bus ads, the billboards, etc. Like right now, if you look on our social media, you'll see that we're participating in the LGBTQ History Month. So we've been posting a lot of people from the ballroom scene, from the drag community, and some of their statements on HIV. And then at the end of the month, all of their statements about HIV will compile together so that we can understand how HIV has affected the various pieces of community that we have here in Pittsburgh. Um, Moving forward to look at some of the different pieces of media that we have placed out there. We have some radio ads. We have like digital advertisements. We've been placed in various newspapers. I I was so prepared to walk. I at my desk is the Best of Pittsburgh newspaper, and I don't know why I did not grab it, but it is okay. I will grab it after I'm done presenting. And then to your far left is our direct mailer. A direct mailer is sent out to about 1 million households in the southwestern region of Pennsylvania. And we do this like once a year. And it's basically to allow the residents of the southwestern region of Pennsylvania to know, hey, the language is still changing. Hey, the services are still available for individuals who are directly impacted by HIV. Thank you. We got it. Um, for individuals who are directly impacted by HIV. And it's also to allow community partners to know that there are various forms of outreach. Like we had a partner reach out to us and was like, hey, how did you get this direct mailer? Like, how can we do this? Like, can you point us in the right direction? And we did because we know it takes community. It takes like collaboration. All of us, we have to work together in order to continue to end stigma, continue to better programming for our community members. And yeah. Now, here are some more pieces of our media, like that you'll see on the side of buses and the shelters. Um, Sometimes when you see some of this media, it may have a QR code. If those QR codes for some reason don't work, please let us know. Please. Because that, oh gosh, I do not like that. It makes me feel incompetent. Um, moving forward for more media. Oh, no. So this is a reflection of our hotline data that I briefly told you about. So the phone number at the beginning of the slideshow, 412-773-1120, is our hotline phone number, and it's also like our help desk phone number. So when people are calling to be referred to care or to be referred to resources, or when people are calling to let us know like they are feeling like they may be lost to care, or they may be feeling like their case is not moving forward or progressing, they call that phone number and they let us know what's happening. So, um, and just to go over some of the data for the past 2 years, some of this data was collected solely in 2024, and some of the data we tried to collect as much of it as we can in 2023. We did begin collecting this data and putting more use to it at the beginning of 2023, once we realized in 2022 that it was going to be a motif for us. So going over 2023, it was sent out to Allegheny County residents, and we had about 100, well, not about, we had 175 calls. I cannot move this. Yes. Of those 175 calls and texts and emails, we were able to connect four children to resources, like getting them referred to one of our partners or one of our community organizations so that those children can receive some type of resource or service. Of those 175, 13 of the calls came from out of state. So out of state calls were classified as people who were moving to Pittsburgh or have recently moved to, well, let me not say Pittsburgh, but the southwestern region of Pennsylvania. They're either moving here or they've recently moved here. If they let me know that they're still in another state and they're just like calling to hear about the program, I don't incorporate that into this data, but it is still logged into our overall data system. With the out-of-state calls, I just wanted to really highlight the continued motif of a lot of the southern states like wanting to come to Pennsylvania because of our work is impeccable. Like people love hearing about the stuff we're doing. They love hearing about the stuff that we do. I mean, not do, like the stuff that we create that the community are able to come and enjoy. So in 2024, it went to the entire T of the southwestern region of Pennsylvania, and we had about 341 calls. Oh my goodness, you all. Of those 341, 226 of them were referred to resource or referred to service, connected to some type of service. We were able to connect two children to resources, and we had about 7 out-of-state calls, um, including not including extra pieces of data that I thought was really important was that we were able to get 10 new people to sign up for volunteering throughout the year. So whether they wanted to volunteer on 2 Hot for July or they want to participate in our 10-year AIDS Free Pittsburgh Gala, like they said that they wanted, they was here for it. They liked it. They came to 2 Hot. They loved it. Um, and then we had about 22 phone calls of just general information. They wanted to know about the Ryan White program. They wanted to know about AIDS Free Pittsburgh. They wanted to know like the parameters of the Ryan White programming. And if there was any other programming that existed, like SBVP and like it's just a bunch of stuff because we know like we just need to be here for our community. And then lastly, I thought that it would be really important to highlight some of the more popular reasons why people were calling. So housing, we know, is always going to be an issue there. Like it's just, well, we hope it's not always going to be an issue. Let me not say it like that because that does not make me sound optimistic. Uh, housing, we know, is like somewhat of an issue. Food has become more of an issue as we begin to arise with more food deserts. Dental is an issue. I don't want to create a theory on that one. Don't want to lie to y'all. Transportation has been an issue, but I also think the transportation being an issue is just because of the community is getting older. Um, and then the lastly was medical case management. So a lot of people have been having difficult times with just finding an organization that understands them or finding an organization that hears them out. Um, yeah, like being heard has been something that's always reoccurring over and over when we get phone calls here at AFP. Skip. So, yes, 2 Hot for July and the category is red. We're almost finished, you all. We are almost finished. And I'm like really good on time. So 2 Hot for July is our annual biomedical event. Last year we had Alex Newell come. The year previous to that, we had Dream Doll. Previous to that, Saucy Santana. But I'm saying this because we bring in some type of headliner to help encourage participation, to help encourage testing, because we know a test a day can let you know your status, baby. So it's best to know your status. Like, don't guess, get checked. This has been stuff we've been saying forever. And utilizing a platform like 2 Hot for July to encourage people to be tested is astronomical because a lot of people don't think that they can go to events like this and get educated or be tested or like go somewhere and have fun safely, like knowing that, like, oh, Like if I wanted to be tested or if I just wanted to know about something, I can go ask a medical professional. Like right here in real time. I don't have to set up an appointment. I don't have to set up and wait, or I don't have to like go to Google.md and think I'm having cancer for the next like 2 months until I see a doctor. And then the category is red. Is like our bicentennial. Like I want it to be more regular, but right now it's going to be like almost every other year. But it's basically to allow our community members to finally feel fresh, like to feel like one of those girls. Like the whenever we created it, we really wanted people to know that like it's okay for you to come tell your story here and not feel judged. It's okay for you to come be amongst other individuals who you can relate to, knowing that you're not being stigmatized or you're not being thought about in any negative or ill way. Now, if you have beef with a person, I'm not going to stop them. But overall, that was the entire premise and purpose of the category is red. And just for a little bit more tidbit and highlight so that you all understand why testing is so important to us. In 2024, we had an event for Black HIV Awareness Day. We had 110 people show up, and we had about 26 people tested for STIs and or HIV, well over 10%. That's always my goal. Too Hot for July, we had over 1,000 people come and participate. We had about 60 people tested for HIV. We did not count in the other STI testing. Um, we had 8 people who did stuff with hepatitis C. I believe they were vaccinated. And then we had 20 people who were vaxxed with Mpox. And now, last part of the presentation, which is my favorite part, which is our Too Hot for July recap. And after this, we will leave the floor open for questions. I'm sorry, you all. I really did hope that this video was playing. Just for some context, some overview, it encompasses Too Hot for July, especially this past year that just passed. It was one of our bigger Too Hot for Julys. I went over the testing numbers with you all. If you really want to see the video, we can go to toohotforjuly. You can go to toohotforjuly.com. And that's spelled out just how it is, like TOOHOT for July.com. And you'll be able to find all of the videos and photos from this year and previous years. I'm going to be sending it in the chat if it allows this to pop up. Chat. Yes, here we are. And going to this website, you'll be able to see all things Too Hot. Now, be the change you want to see in your community. You do this by creating program, having conversations about the past, highlighting your peers. That's extremely important. If your peers know that you appreciate them, they will appreciate you and show up and show out every single time. Having conversations about the past because you don't want to recreate the wheel, and you also don't want to just continue to do endless programming. Like if somebody's saying like tried to do a dance party and no one showed up, well, please don't do a dance party in red thinking everyone is going to show up because they obviously don't want to dance. Um, celebrate each other. So showing up to each other's events and letting each other know, like, oh, this is dope. This is awesome. I really enjoy this. Like showing up as a community member, going back to what I said before, is like sometimes not showing up is important. Like if sometimes showing up as a community member and not a community organization or as a community leader is so much more important than just sponsoring an event and showing up, because now people feel like, oh, the only reason I'm going to be able to see you is if you sponsor. And no one wants to feel like they're only like being used. Like, that does not feel good. Um, Ask questions and have fun. Like when you're having these events, don't stand there like a rigid in the wall. Like have fun at them. You created this event for people to have fun. You created this program for people to like be different. You created this avenue of creativity for people to be creative. So why would you take that away from them? That's not fair. Um, and then don't cherry pick. Like I know here at AIDS Free Pittsburgh, like sometimes it's really difficult for us to do events encompassing some communities. So we'll partner with someone who we know is really good at getting that community out there or encouraging participation from that specific demographic. Like if you know for sure your organization is great at specific stuff, let us know so that we can continue to let people know that your organization is good at that. Or if your organization is like trying to get more insight or more visibility in a specific area, let us know. Like, because what could be working for me could also work for you. Even though they're two different neighborhoods, like it still crosses over, it still makes sense. So all of this is to say, understand your community, understand the words that your community is saying to you so that you can create language to eliminate stigma and develop programming to benefit your community. Um, don't be afraid to ask questions and call people out. Like call community members out, call community leaders out, organizations, like let them know like we are here because we want change. Um, and if any of you are interested in joining the AIDS Free Pittsburgh community or just being a part of our newsletter, please let me know. You can call or text 412-773-1120 or email us at info@aidsfreepittsburgh.com.org, not .com. Oh gosh. Um, and then please follow our social media, follow our Instagram, follow our Facebook to stay updated on all things AFP because we're going to be doing a lot more programming next year with it being our 10th year. So I'm really excited about that. Um, and we just hope that you all continue to participate and come enjoy everything that we have to offer. Are there any questions?
Thank you so much for sharing, Hazel.
No problem.
And
I'm
while
upset
I
about the video.
Well, we can send it out too. I will be sending out, I forgot to mention this at the beginning. I'll send out a recording to everyone who's registered and to all of our sponsors with the recording of this. And I can include a link to the video too, so folks can view that on their own time. Also, I wanted to share while we'll give people some time to see if they have any questions, which they can type into the Q&A box. Or I think if you hit raise hand, I can take you off of mute to ask your question out loud if you're feeling brave. But while you're all considering if you have any questions, I wanted to mention an event for World AIDS Day from one of our sponsors for this event, the Mid-Atlantic Education and Training Center. This will be on December 4th. It's a webinar from 8:30 a.m. to 4:45 for World AIDS Day. The theme is From Awareness to Action, Prioritizing Person-Centered HIV Prevention and Treatment. And you can get more information at maaetc.org. And I will include that in my email out after this as well. And I also wanted to mention that thanks to all of our sponsors, we distributed 290, just over 290 of these t-shirts. So if you consider, we're all out here wearing our t-shirts, that is spreading so much awareness throughout our communities just by having these messages on a t-shirt. So thank you, Hazel, very much. And thanks again to our sponsors. It doesn't look like we have any questions. Oh, I spoke too soon. We have one question. What are some of the issues you see in HIV awareness, especially in the Mon Valley?
There recently, and this is probably like all around Pittsburgh as well, there have been a lot more immigrants and migrants that have come. So that has been something that's been really difficult, especially with referring people in Mon Valley, because there's that language barrier. I might not understand everything that person is asking. So sometimes I will tell them like, hey, can you email me? Like And it doesn't matter what language they email me because we have like language services here where it'll like translate it for us, or we can call like a translator and interpreter and stuff. But typically that's been the issue in the Mon Valley is like getting between that language barrier to know where and how to give them a resource. Because even if they call me, like they might not understand English enough for me to like text them the resources or email them the resources. So now, like I am following up, making sure they translated it, called one of the partners, and sometimes I might have to call the partner with them and like transfer the phone call over and like it's not bad, but sometimes it I can tell the partners get frustrated
Mhm.
um just because of that language barrier.
Thank you. Any other questions? Oh, I
And then
see a
if we're not
raised.
speak sorry.
Oh, I see a raised hand. I think I'm going to allow you to talk, Boniface. Let's see if this will work. I've never done this before. Oh, there you are.
Am I on?
Yes, you are.
Mhm.
Awesome, awesome, Hazel. Thanks again for that presentation. Awesome information. So, two quick questions here. First one, I think you probably answered it, but I just want to double check. So, your goal 2030 is to have 75% reduction, right?
Yes.
Right. And you say at this point, you're about maybe 55% towards your goal, right?
Yes.
Awesome, awesome. So you got 5 years to work hard to get to that, right? 2030.
Yes.
You're doing well. All right. And that second question. So in your part, I mean, bar chart, you had shown that 25 to 34, that age group scores very high. What's the reason for that? If maybe you covered it, but I just want to um, be sure I understand why that age group is so high.
So the 25 to 34-year-old age group, I don't want to just go speaking out my rear end and like lying to you, but I can tell you my theory. Um, so that 25 to 34-year-old age range is about this. If we think about this 10 years ago, all of those individuals were youth. They were younger. They were fresh to the game. They were still learning information and stuff. And with prep and PEP being so new and so fresh, I feel like with them, this is all still my own conspiracy theory. Um, I feel like with a lot of the youth, like being more aware of PrEP and being more aware of those type of like medical prevention tools, that they just are having a lot more liberal fun and not practicing like safe fun. So they could like that's my hunch. Like I feel like they're just putting too much faith in medicine and not actually like practicing a good practice. But I could be incorrect. This is my conspiracy theory.
Thank you so much. That was great. Appreciate it.
Mhm.